Well, there are certain disadvantages to living in rural areas. One is limited access to emergency medical care. One local town is training its citizens on how they can step in and help save someone's life. KSBY reporter Mackenzie Diaz traveled to Cambria to show us how the Community Healthcare District is putting a powerful piece of medical equipment in the hands of residents. Mackenzie?
Well, knowing how to use an AED can save someone's life when literally every second counts.
Most people want to do something, they just don't know what to do.
In general, a person can only survive for a very short time without oxygen to their brain. Using an AED when someone's experiencing sudden cardiac arrest will increase that person's chance of survival.
3 to 5 minutes without oxygen is where brain tissue starts to die.
And unfortunately, in most cases, it will take a lot longer than that for rescue workers to reach someone in need of emergent care. Transportation time takes a while, and Cambria paramedics have a large area to cover. They run all the way up the coast.
Our time actually getting on scene can be anywhere from 35 to 45 minutes to an hour.
We'll be there as fast as we can, but them having some training gives them the ability to also help. We're looking at 9 to 10 minutes easily from the time that the patient collapses till we get there.
The equipment assesses whether the heart is beating normally or if it's stopped and must be shocked.
Then you would just wait for 911 because there's a chance they could have had a seizure or a syncopal episode, their blood pressure got too low or something like that. So anytime that a person collapses, what we tell everybody is to dial 911 and have somebody go get the defibrillator. You can actually put it on the patient's chest, and because of the way that these are programmed, it won't shock somebody if they don't need to be shocked. But if they do, that early defibrillation is going to make a difference and could possibly save their life.
The encouraging news is that you can safely use an AED without taking the course, thanks to the voice prompt that guides the user through the process. But Bennis says even with the successful cases, don't expect a Hollywood type of ending.
When they shock somebody on TV and it's a flat line and suddenly the patient wakes up and starts talking, 100% Hollywood, I'm sorry to say. It does not happen.
The AED training session runs for 2.5 hours. It's shorter than the traditional CPR course, which takes 8 hours to complete. Live in the studio, Mackenzie Diaz, KSBY News.